Good morning, doctors. I am Remo Caballero, the Chief Fellow of Surgical Oncology, along with our Head Training Officer, mentors, and fellows. I would like to welcome you to St. Luke's Medical Center. So, the Surgical Oncology Fellowship Program of St. Luke's Medical Center was established in 1995 with the program objective of producing a competent, ethical, socially relevant, and research-oriented surgical oncologist knowledgeable in prevention, causation and detection, rehabilitation, and treatment of cancer under the concept of multidisciplinary team approach. It is an accredited program of the SOSP. The surgical oncology is a division of the Institute of General Surgery, which is headed by Dr. Richard Nunez in Quezon City and Dr. Hermogenes Monroy in Global City. The Division of Surgical Oncology is headed by Dr. Hipolito in Quezon City and Dr. Navarro in Global City. Training is led by our training officer, Dr. Manuel Azares, along with the committee composed of the Doctors Roel Tolentino, Grace Dayan Raimundo, Christian Ang, and Helen Ang. The division is also composed of following sections, including the head and neck, breast oncology, esophagogastric oncology, colorectal oncology, hepatobiliary pancreatic oncology, skin and soft tissue oncology, cytoreductive surgery and peritoneal surface malignancy, minimally invasive oncology, and oncoplasty and reconstructive surgery. As mentioned, our training committee is composed of Dr. Azaris and the following members. Our clinical research committee is headed by Dr. Isaac David Ampil II, along with the doctors Helen Amo, Kasit Pasha, and Dr. Ruel Tolentino. Research advisors are doctors Edgardo Cortez, Samuel Ang, and Dr. Pagdanana. These are the list of the active faculty uh, in St. Luke's St. Luke's Quezon City with the following head of each section. Head and neck headed by Dr. Edgardo Cortez, breast oncology by Dr. Pagdanganan, esophagogastric oncology by Dr. Antil, colorectal oncology headed by Dr. Azares, hepatobiliary and pancreatic oncology headed by Dr. Hipolito, skin and soft tissue oncology headed by Dr. Dumlao, cytoreductive surgery and peritoneal surface malignancy also headed by Dr. Hipolito, minimally invasive surgical oncology headed by Dr. Tan, and oncoplastic and reconstructive surgery headed by Dr. Arcilia. This is the list of faculty in Global City with the following heads also of each section. So, and the next also led by Dr. Cortez, breast oncology by Dr. Gemma Uy, esophagogastric oncology by Dr. De La Peña, colorectal oncology by Dr. Monroy, hepatobiliary by Dr. Consejero, and soft tissue oncology by Dr. De La Peña. I would like to give you a brief tour of the physical structure in our institution that are relevant to the training. The fellows are trained in both St. Luke's Medical Center, Quezon City, and Global City. These are level 3 medical centers with 650 bed capacity in Quezon City and 600 bed capacity in Global City. The following are the available departments, institutes, and centers relevant to the training and practice of surgical oncology. Move forward. The main operating room complex in both hospitals is where all major surgeries are done. It is composed of 12 rooms in Quezon City, 16 rooms in Global City. This theater is designed for a wide range of surgical procedures and are equipped with the latest anesthesia methods. We are also fortunate to acquire the latest high-tech machine. It is the RAN Performer 3, which is the latest machine compatible for high-tech, limb, liver, and lung perfusion. The system is also flexible to be used for open, closed, or semi-closed closed abdomen and laparoscopic surgery. In 2010, St. Luke's made history by introducing the first advanced robotic surgery system in the country. This is the third generation Da Vinci surgical system. It is a sophisticated robotic surgical technology where St. Luke's surgeons now provide patients with the best possible health care with minimal risk and premise of faster recovery, along with other MIS facilities such as the video-assisted thoracoscopic cardiovascular surgery and laparoscopic towers and instruments. These are the critical care available in both St. Luke's and global cities. Uh, Both hospital has medical ICU. Here at Quezon City, we have 12 beds. Both hospital also have coronary care units with 12 beds, neurocritical care units with 8 beds, and acute stroke units with 3 beds. Special critical care units in Global City includes the surgical intensive care units with 6 beds and liver intensive care units with 5 beds. The outpatient department is where the fellows do consultation for social service patients. Here, perioperative evaluation and follow-up, as well as minor surgical procedure are done with consultant supervision. Vital to our practice and training are available service of the Institute of Pathology. We have the following laboratories: the hematology, serology, biochemistry, and microbiology. We also have the blood bank and clinical immunology. The histopathology section does frozen section and immunohistochemistry for breast, sarcoma, neuroendocrine tumors, cysts, and others. The Institute has established the most comprehensive library of monoclonal antibodies for immunohistochemistry and has built a reputation as a referral center for difficult surgical pathology cases. The section of cellular immunology and immunogenetics, which is well equipped with the latest automated immunology analyzer, combines allied disciplines of tissue typing and flow cytometry, and offers the most extensive test in the country. Here, we are able to obtain and correlate the results of the next generation sequencing, such as the Foundation 1, the FISH, and molecular tests like the mammogram and Oncotype DX. Along with the latest pathology facilities, you also have pathologists who are expert in the specialized fields. These are the list of the consultants and their subspecialties. Uh, to mention some are Dr. Ang and Dr. Arevalo, which are hematopathology or lymphomas expert. Um, Dr. So, which is a genitourinary pathologist, and Dr. Madrid, which is a breast pathology specialist. For imaging, St. Luke's has the best imaging diagnostic necessary for our training and clinical outcomes. One of these is X-ray facility. We are equipped with computerized radiography system and fully automated radiology information system, which allows medical imaging access to doctors anywhere in computers connected to the St. Luke's network. Through this, the trainees can access patient files and provide immediate feedback to the mentors, thereby facilitating clinical decisions. We have 5 available CT scan here at St. Luke's with specialized readers. Recently, we acquired the 1,152 slice CT scan, which is utilized for advanced enchanting imaging needs, cardiac scanning, and has the advantage of using less contrast for geriatric and pediatric patients. Radiology department has subspecialists per organ system for reading challenging cases. Fellows, surgical oncology fellows, are present during these procedures and review images along with radio consultants. The MRI is also available with one 3 Tesla and two 1.5 Tesla machines. All ultrasound machines are widely available in the hospital. Features in these photos are for general ultrasound. Some are portable, which can be used for bedside procedures. There are also sonologists specializing on specific organ systems for better ultrasound interpretation. St. Luke's recently also launched the HIFU, or the high intensity focused ultrasound, which performs non-surgical treatment and is currently being utilized for gynecological cases. The PET CT scan is essential for the practice and training of surgical oncology, which is also available in our institution. Along with this, the Department of Nuclear Medicine has the following services: radio immunoassay, bone densitometry, RBC tagging, dotadate scan, gallium scan, theranostics, and REI. Um, Under nuclear medicine, we also have the SPECT-CT and gamma probe, which aids surgeon in localizing the sentinel node for breast and other applications. Important also for both diagnostic and intervention is the breast center, which offers the following services. They have the 2D and 3D breast ultrasound, digital mammography, elastography, galactography, mammo-guided needle localization, the mammotome. We also have, I think, the only machine here in the Philippines, the stereotactic uh, breast biopsy or the mammo test. We have this tomosynthesis and ultrasound guided needle localization. Our cath lab is equipped with vascular stenting, TACE, per, uh, TACE and for percutaneous RFA, microwave and stenting. The endoscopy unit offers advanced endoscopic procedure, including capsule endoscopy, endoscopic mucosal resection, endoscopic ultrasound, ERCP, biliary stenting, and GI stenting. The fellows are able to observe these procedures. We actually learn from also from the consultant of the GI department. We also we are also able to do thyroid biopsy with ultrasound guidance in the endocrine center. Under radiation oncology, um, these are the services offered. Radiation oncology offers a list of procedure and used in different types of cancer. We have the conventional RT, KDCRT, SRS, and FSRS. Remark, we also have the HD brachytherapy. It is an image-guided RT and brachytherapy and total body irradiation. Important feature of the St. Luke's linear accelerator is respiratory gating, which allows tumors in areas of the body that move, such as the upper abdomen and the lower lung, to be treated accurately. The Research and Biotechnology Group is pioneered in St. Luke's and it houses the Cancer Biobank and molecular and genomic research. It is also a center of clinical trials as it has a level 4 IERC. Molecular tests unique to St. Luke's are the tests for determining aggressiveness of thyroid cancer and fish study for leukemias. Currently, currently under optimization are the following: MSI testing for colon cancer, genetic testing for CML, and analytic chemistry techniques for gene expression in PET. The Division of Surgical Oncology is part of the Cancer Institute. It is a multidisciplinary center of the oncologic clinicians. It has pain and palliative care specialists and oncologic nursing care. This institute has the following services: the ambulatory chemotherapy, cancer consultation network, tumor boards, multidisciplinary conferences, and family conferences. The St. Luke's Cancer Institute is also equipped with specialist oncology pharmacy. These are manned by licensed pharmacists with special training in how to compound, administer, and monitor chemotherapy. Under the Cancer Institute, fellows are provided with lounge in both hospitals. There are also conference room where we can hold our conferences or presentations are held. We have available resources that aid in our training. The St. Luke's College of Medicine Library ac- access to journal subscription and to up to date. Up to date is a downloadable app composed of compendium of resources and journals that aid in clinical decision. These are the list of some of the ebooks available to the fellows. So for the training program requirements, the division has produced 37 surgical oncologists in 27 years, all distributed over the Philippines. This is our turnout during the latest SOSP diplomate exam. 100% passed the written exam, while 88% passed the oral exam. So, of the 8 applicants, 88% are full diplomates. 7 of 8 takers. We have also produced a number of research that were presented locally and are for publication. We have several. We have meta-analyses, a retrospective study, and several case reports. These are the case reports of the previous fellows. And these are the current ongoing researches of the current fellows of the institute, of the division. So currently we have 4 fellows in training. That includes me, the chief fellow, Dr. Mosa, also the a senior fellow, and Dr. Paulo Manalastas and Kiefer Busto. Per fellow schedule, um, fellow schedule of hospital rotation. So, 2 surgical fellows per hospital, both in Quezon City and Global City. Switching of hospital rotation is every 2 months for the junior fellow and every 3 months for the senior fellows. Our outpatient clinic is from Monday to Friday 8 to 12 noon. We also have clinical oncology rotations for the following subspecialties, including the radiation oncology, Institute of Pathology, medical oncology, and breast center. Um, the fellow, yes, sir. And these are the fellow schedule of hospital rotation, including the um, module which is done by monthly. As a walkthrough to our schedule, we do daily bedside rounds for perioperative care and planning along with our mentors. Every Saturday, we have our surgical oncology conference which covers pre and post operative discussion, census reporting, mortality and morbidity, and grand rounds. We also have weekly submission of journals and appraisal reports, as well as a multidisciplinary tumor boards conferences. Evaluation and examination occur quarterly, and as needed, fellows are involved also in family conferences with attending physicians. So, for the summary of the conferences last year, we have a total of 60 pre and post operative conferences, including the census and mortality. We have 31 tumor boards, journal appraisal 48, and we were invited to report on the Cancer Commission reports. Um, Most of the conferences are held via online meeting. For this year, we have two major activities, which is the 34 postgraduate course of critical decisions in practice of surgical oncology, and um, achieved by adapting to the changing ideas and evolving essentials in breast cancer. Other major activities from last year also includes the hospital grand rounds, annual convention of the Breast Society, and the 30th PCS CAHO. For our